to shadow a case manager, RN BSN, who works with post-op patients on an orthopedic floor. She works on placing patients in a rehab or a long-term care facility, depending on where their insurance will cover and depending on what surgery they've had. Next, I was able to shadow an orthopedic RN BSN floor nurse. This was neat because I was able to focus on post-op education with patients and the type of movements that they can do, what type of braces they need to wear, and the pain that they can expect when they go home. Next, for my last day, I was able to work with the pain management RN BSN. And this was a little different because this position was created during their pain management orientation, and they couldn't get patients' pain under control, so they created this position to better help with patients' pain. And what this nurse does is works directly with the nurse anesthetist and the anesthesiologist and pulls up all of their medications, whether it's sedation, nerve blocks, local anesthetics, and works with them and incorporates that teaching into pre-op for patients so that they can be aware of what kind of nerve blocks are going to be happening, where they'll expect pain, where they won't, and what they'll expect post-op. Also, this nurse teaches patients when they go home with the on-cue ball. And this ball is a ball full of a local anesthetic that patients go home with for about 46 hours. And it's a nerve catheter that goes and sits right next to a nerve and allows just local anesthetic to go into that area where they've had surgery. So it's a great way to help prevent pain for post-op patients, and it has definitely decreased on narcotic usage, which is a huge deal. And this type of education for patients has been very beneficial at this facility. And my learning goal for my evidence-based practice project was how to learn more about what educational ideas create the strongest learning results in patients that are greater than 65. My first learning objective was how do we educate our patients before they are discharged, especially on the orthopedic post-op surgery floors. And two ways that they're implementing this at my practicum site was through the teach back method, which is commonly used in facilities, and it's where we show the patient how to do something or how to change a dressing or any type of thing that they're going to be doing post-op, and they teach it back to us and show us exactly how it's done so that we are right there and we can critique anything that they've done so that they're doing it properly and so that they can ask us questions while they're doing it for the first time. And the other way that I saw that a lot of teaching was done was through the Cranes On Demand website. And this website is free to use for a hospital facility, and what it does is you can type in anything that you want into this search bar, whether it's post-op surgery pain, whether it is how to change a dressing, whether it's side effects for medication, anything that you want to teach the patient, you can type into this and it will give you a list of common side effects, when to speak with your doctor, etc. So it's a really good take-home document for patients so that they can have something handheld in case they didn't grasp everything that was said during discharge. My next learning objective was which way do patients find that it is easiest to learn for their post-op discharge instructions. And this objective was kind of hard to find an exact result because I couldn't take a survey of the entire patient population in the hospital. But what my preceptors and I found was that a lot of patients really liked the teach back method. This method provides an open room for patients to ask questions while you visibly watch them perform the procedure or whatever type of post-op instructions that they need to be following. And this actually seemed to create a lot less questions instead of just handing a patient a document and saying, here you go. And it really seemed to provide better teaching for them. My last learning objectives was how often do we follow up with these patients after they're discharged and sent home. The answer that I got was from an RN BSN call center nurse that taught me about how patients that are admitted with a LACE score of 7 or greater initially to the hospital pharmacy medicines, things like that. And throughout those days, they just do follow-ups with patients, set up follow-up appointments for them, and it's a really good way to stay in touch with our patients so that we can make sure that they're comfortable, that their pain is relieved, that they're receiving their post-op medications that they need, that they don't have any questions about their discharge instructions. There was a study that this call center actually did that showed for every one call that was made to a patient, there was a 2% decrease in readmission rates for that patient, which I found pretty astounding because with the decrease in readmission rates, then every hospital is reimbursed for that patient and by insurance, which is a huge deal. So I thought this call center was a really neat program that my practical facility initiates. When comparing what I saw at bedside compared to the literature that I'm reading, I noticed that bedside nurse reporting was a huge deal and really initiated in my practicum site. And I noticed that each nurse would discuss the patient's care outside the room. Then they would go into the patient's room, meet the patient, ask them if they had any questions, how they were feeling, how their pain was, and would discuss the care if the family was there and if the patient didn't mind if they discussed that in front of the family. And I think this is a really great way to implement a great communication source and to allow everybody on the same page, the patient, both nurses, the nurse that was there for that shift and the oncoming nurse, and the family. And it really helps to include everyone in this patient's care. I was reading in the NANS book on page 189 of nurses that did bedside rounding and how they rounded together on 5 patients, and it really just created a holistic and a great environment for the patient and allowed the patient to feel a sense of autonomy in their care. One of the best practices that has been implemented in my practical setting is the teach-back method. It is stated by the Journal of Pediatric Nursing that the teach-back method process is a comprehensive, interdisciplinary, evidence-based strategy which can empower nursing staff to verify understanding, correct inaccurate information, and reinforce medication teaching and new home care skills with patients and families. And that comes from Kornberger 2013. Another best practice technique that was used in my practicum site is the CRAMES on-demand website. It was stated, to keep education sessions clearly documented for the entire healthcare team, hospitals use CRAMES on Demand, which is a web-based application offering access to thousands of CRAMES patient education handouts. CRAMES on Demand offers staff the ability to document the patient education encounter and content, as well as learning assessment report. Throughout the hospital stay, educators use the program to keep track of the patient's ongoing educational progress. It was also stated, quote, when we communicate or document effectively the answers to these questions, it becomes clear where the gaps in learning takes place. And this is stated from Robinson from the CRAMES website. When reflecting on the personal effect that my practicum hours have had on me, I feel that as a nurse, I will be able to better educate my patients while they're in the hospital and right before discharge. And the 2 ways that I will do that is to provide the teach-back method to allow my patients to teach back what I am teaching them. So if they have any questions, I'll be right there to answer anything that they need. And I will also implement the CRAMES On Demand website, which is a great tool for patients to take home if they didn't grasp everything that you said while you all were discussing all kinds of discharge instructions before they were sent home. I'm also very interested to see if we have a call center at the facility that I'm a nurse at. The fact that by every 1 call, a readmission was decreased by 2% is an outstanding number to me, and I'm really interested to see if that's implemented at my facility. Overall, I feel that educating our patients is one of the main things that we need to do as nurses because it prevents readmissions, keeps our patients healthier, and overall it keeps them out of the hospital and safer. So I feel that I've greatly improved my education techniques from my practicum hours, and I've learned a lot of other ways to really educate and implement different